Okay, so our first phase of research, we really focused on, are there vulnerabilities inside of these connected medical devices, and what type of vulnerabilities are we finding? Are they security hygiene items, or are there evidence of advanced attacks or vulnerabilities associated with these types of devices? So we looked across devices and across modalities, so everything from infusion pumps to radiology equipment of MRI, CT scanners, into some of the implantable devices out there in the environment. And what we found was really security hygiene items were the biggest issue. So we looked at the use of hard-coded or default weak administrative credentials that would give an attacker full access to a device. We also found, secondly, the inability or lack of ability to update these devices from known vulnerabilities through the use of software patches, for example. And thirdly, we've seen a lack of encryption, both during transit as well as storing images, for example, on radiology systems and back-end storage systems. The second phase of research focused on moving that outside of the walls, the perimeter of the hospital, and said, we now know that we have vulnerabilities in these connected medical devices. Is there exposure, direct internet-facing exposure, that attackers could access medical devices? So we found misconfigurations in thousands of healthcare organizations that allowed direct attack vectors into these misconfigured systems and allowed attackers to then easily browse and know exactly what types of devices they were able to access inside of the medical environment.